been uploaded.
Hey, good evening to everybody, and welcome to everybody who's watching it now or who's going to watch it later. It's a privilege to host fabulous Futuristic Fridays. I just added an F to it, and we're lucky to have AbhimanyuBhosale with us today. He's the CEO and co-founder of Crelio Health, and formerly called Live Health. Uh, Before I get into what he does, which I would like him to tell us, uh, growing up, I think so. Some of us who watched Star Wars and loved watching it still remember that whenever somebody fell sick on the USS Enterprise, somebody came with a little tablet and hovered it around the sick patient and knew what was wrong. And diagnostics from the tablet gave the disease and maybe the curative part too. I think so. We've come very close to that today. We've come very close to whoever had thought about it today. And part of this journey to be, even seemingly conceivable today goes to companies that Abhimanyu founded and is running today. So Abhimanyu, thank you for joining us in the VOH broadcast today, and give us a quick take on Crelio Health and what you guys do, and then we'll jump into the discussion right there.
Sure. Thanks, Sumit. So Crelio Health basically is, so we build automation solutions for medical diagnostic labs, really helping them streamline internal processes and, a lot of mundane tasks, automating that. But ultimately, where a larger impact is actually improving patient communication and really, giving analyzed results to doctors, patients, insurance providers, and hospitals. So really kind of augmenting the value out of diagnostic data from a traditional report to something more, insightful.
Okay, so what you're saying, in a way that you do end to end for these diagnostic labs from the front desk till the reporting.
Reporting.
Yeah. Okay. Fair enough. That's one way of putting it. So yes, we know the medical diagnostics in India has changed a lot for the better, I must say, and hugely in a short span of time.
Correct.
So where do we stand currently in terms of medical diagnostics, and what do you think in terms of possible improvements that we need to see coming forward? Where do you think we are in terms of where the market stands in terms of its, as you said, its ability to give quality results?
Yeah. Well, we see that, a market of like 1.2 billion people, and diagnostic becoming like the default or standard for clinicians. About 80% of the clinical decisions actually depend on diagnostic tests. There are a lot of labs that are required to actually process this, pan India, and about 15% of those labs are actually organized, which are under the branded centers, which are mostly multi-locational. And when we come to the long tail, they're mostly independently run labs by pathologists. And currently it seems that while all of these labs are actually trying their best to scale and provide quality results at that scale,
Sure.
it has been difficult to scale beyond a certain point, and that it has been difficult for even larger labs, in fact, to scale beyond a certain point without the help of technology. And we know that for us to provide these services to more and more customers every day at lower and lower costs, technology it's a classic technology problem. And we believe that as better systems come around, and as laboratories actually get digitized, and we already envision a lab of the future that is entirely digital, paperless, and completely self-serve. In that vision of the future, it is a key milestone for most of the labs in India actually to go digital, save on their costs, improve their quality, improve reliability on their services, and ultimately give or deliver better patient experience. So that's how we see the market going. That's where we are currently.
Okay, so you mean to say there's still a long way to go in terms of the digitization of this of the diagnostic laboratories are concerned. There's still a huge sector that that needs to be maybe looked at for it to be digitized, right?
That
A
is
huge
true.
amount of it.
Recently there was this, pretty much any survey actually, majority of the centers, more than 50% of the centers are actually not using technology tools, or the ones which are using are using very basic softwares, which don't help as much as so there's definitely a long way to go in terms of the end-to-end digitization of processes, especially pan India. But we see major initiatives happening, right? From SaaS companies like ours actually coming out and automating different parts of healthcare, to, for example, the government's initiative for the NDHM, to really standardize the facility registry, interoperability of information, and these are actually becoming very crucial.
Good.
So
Now, yeah. So basically, also today, telemedicine, I think so, is a reality. Okay, it till pre-pandemic, it was something of the future, right? And today, I think so, it's the present, right? And now, whether it be telemedicine, online healthcare, whatever that, I think so, it's going to be part of the new normal going
yeah.
forward, right? Where do uh, the role of data, of analytics, of AI, all these come in? As how will it augment, or rather, how will it help telemedicine? Take on a new growth in India. Where do you see it going? A combination of diagnostics, telemedicine, and other allied features going forward.
So, if you see like diagnostics really actually catching up, and if we see like that growth, in the laboratory space, um, diagnostics is already crucial. But telemedicine basically relies on that information, that data that really tells either a longitudinal history of the patient, or basically more insights about who they are serving, right? So if I'm looking at a patient online, I need to know what are his vitals, what are his like health parameters, and if there is a historical, longitudinal record that I can rely on for improving my diagnosis, because I can't now look and feel the patient as the way I can actually in a actual practice. So I see it as indispensable. In fact, that is going to be a very important milestone for the next stage, and there is no way around it. Like, it has to be a data-driven approach for us to be more reliable, for us to provide more reliable service or healthcare.
Okay. And when we talk about data, I know concerns of privacy that must have been handled by you, which is for sure. Going forward on that, where do you think this data can be used in terms of the data that belongs to not you as a service provider, but data that maybe a diagnostic company has got? How can they use this data in terms of better outcomes?
So, Sumit, I think we've got some very fabulous use cases of data. Like, for example, the COVID crisis has actually shown us how we can monitor COVID results at scale,
Yeah.
right? And in an epidemiological sense, right? Like, we now know which states, which cities are doing good and bad, right? And we can know that in advance. Imagine that for every other infectious disease, right? And that's what we've got on the table. So we're basically saying that all this amount of data is already there. We just have to plug it in a common system, probably a government enabled system that can really start driving these insights at that scale. And it will be very valuable. We would know outbreaks, not just this one, but any, before they happen, or much early, where the state authorities, municipal authorities can actually take action. And it's not that difficult. Once you tap into the data, everything is just a function of that. So yeah.
Yeah. So interoperability of data, I think so that's been a thorn in every
Yes.
IT guys flesh in every country that I know of, from the US to us.
Yes.
Well, that will take a lot of work, I can assure you, and you know it better than me how
Yeah.
much of work that is. But yes,
Yes.
it is for the future at the end of the day.
Yeah.
Yeah, coming to consumers,
Mhm.
let's talk about consumers, uh, especially in the urban, maybe the big city thing. Our expectations of what we want from a diagnostic center has become huge, right? We
Yes.
expect somebody to come home, take a sample, get it done, have the report on our phones within a very short period of time, right?
Correct. Correct.
And I think so. This was accelerated humongously by the COVID-19, right?
Yes.
So, what do you and molecular diagnostics is not everybody's cup of tea, or it wasn't, came to everybody naturally in
Yes.
that way. So, what did you guys do in terms of the whole scaling of this testing that has happened? And how were you a part of scaling this in terms of educations, regulations, workflows? What did you just give us some, insight into that?
Sure. So we basically look at like the entire diagnostic workflow into like three parts. One is, to begin with, like how do you collecting the sample from the patient. So how do you collect like without like basically collecting hands free, and digitizing that first interaction, getting that record or getting that sample in the lab. Then how do we scale that internal lab operation? So how do you do like thousand and ten thousands of samples every day as the COVID demands that? And that involved quite a few critical pieces, right, from like RT-PCR plating automation to automating result processing, getting generating medical records, automating that piece at scale, and then delivering those reports to government authorities, local municipal corporations, as well as patients or doctors who can ultimately use that. So and that was a critical. And finally, the third piece being, okay, easing delivery and verification of record. So as we worked with, like, say, airports and travelers, it was important that we have a record that is verifiable, that is
Hmm.
auditable, and people can rely on it. If it is a COVID negative test, people should know that this is not fake. So and that increasingly became a concern. So yeah.
So the challenges were in terms of, the regulations, in terms of, also maybe these labs which had to report this to ICMR, and
Correct.
the whole, I think so, the whole, how did you increase capacity for these labs? That must have been a great work that you guys have done, and that's fascinating for me to learn. It's very easy to talk about scaling, on a whiteboard, or on an Excel sheet, I'm sure, but in
Correct.
but in the real world, scaling is crazy. How did you help these labs, these diagnostic labs, scale up in the end? Few
Honestly,
key points.
it's kind of a combination of certain generally categorized boring stuff, that is the SOPs, standardization of protocols, trainings, really the stuff that matters the most, honestly. For healthcare workers, they need to know what need to be done when, and the systems need to kind of direct that. So largely we understood that one problem is going to be people capacity,
Yeah.
and the second problem is going to be processing capacity. So the people capacity issue was addressed by really like automating sample workflows, barcoding, and plating of results. And the second piece where we talked about like automating results, what we so these RT-PCR machines actually give us results in, say, Excel or files, and we build systems to kind of automate, get that data, generate reports, and help doctors set up rule engines that they can identify critical patients and non-critical patients, and identify which reports are completely verifiable automatically, and then move fast to delivering that. And among while there was this tech underplay, it was a lot of training for laboratories, right? Like it's because a lab which has not been doing molecular can't just start doing molecular. So that involved, you know, technicians actually knowing, how to do molecular testing, how to extraction, like knowing extraction of like RNA, isolation of that, creating a plate, and then running it for processing. So yeah, that was, I think, a lot of effort orchestrated by multiple stakeholders in this ecosystem, quite frankly. And I think on one side, it's incredible to see so many labs doing molecular overnight. If you see, we had hundreds of labs doing that overnight, where this is just unthinkable in a way. And getting a cost of a molecular test down to like few thousand rupees to like down to a few hundred rupees now is has also been a big challenge, and the entire industry is actually adapted pretty well for that. Yeah.
And all this without reduction in quality, without reduction in errors, right?
For sure, yes.
Because
There's no chance for an error, and it's in COVID, even one wrong report, and it's just like it's the lab is shut down, right? Like so.
Exactly.
Yeah.
So one of the beautiful things about technology is its ability to be able to scale up existing capacity, which is what you have done, right? There is existing capacity, and you have shored that existing capacity by giving them maybe education, maybe workflows, maybe teaching them regulations, the entire workflow automation that has happened. Now,
Correct.
at the end of the day, this is how we have scaled up. This is what we have done in terms of COVID.
Yeah.
Does that form also a blueprint for you to be able to do it for other diagnostic tests?
Yeah, for sure. Actually, a large part of this is repeatable, and in fact, we are creating programs where more and more labs can actually start independently. We're bringing in experts who can actually train or help labs actually start from scratch, and build a lab, say in a tier 2, tier 3 city, and run it with quality. And we required we well, actually realized that large part of the gaps were actually availability of clear protocols and easy to understand content, because there was always a lot of intent to have that many laboratories, but then most of the people didn't end up starting. And really, then once you have the right experts on board who can share their insight, then it's all just about providing tools to make that happen, right? Like it's quite straightforward, and honestly, the heavy lifting is done by our customers. And I would like to say that when we actually read a lot of news that these big labs were actually getting shut down because of the whole delay, and some of our labs actually were processing like more than 8 to 10,000 reports a day, or 8 to 10,000 patients a day. None of our customers actually were shut for even a day during the entire COVID pandemic period. And that was kind of a testimony to us, and how the platform is ultimately helping.
They say India doesn't live in big cities. India lives in the tier 2, tier 3 cities and the villages, right?
Yes.
Okay. The percentages are debatable. Where do you see now telemedicine or medical diagnostics and everything? Where is the connectivity that comes in here? Where do you see 4G and 5G tomorrow going to play a vital part in how these, whether it be telemedicine or medical diagnostic, the way they're delivered to these places?
Well, okay. So one part that 4G, 5G, and the better connectivity comes. One part in healthcare that's going to solve is real-time monitoring and remote monitoring. Right now, one of the biggest gaps in real-time remote monitoring is can we have high-fidelity real-time data pushed anywhere in the planet, right, and anywhere for monitoring that. And often, always the answer is, well, it depends on the connection. It depends on the quality of infrastructure. And the more these problems get solved, remote monitoring or on-demand monitoring or diagnostics would be just a norm. We would, like you were saying, right? Like, so we would have things that plug into our devices and just, test us. So, and that will be possible.
Okay. While you're talking about the future, let's stick to the future part. where do you see a typical home, okay, in whatever, a few years from now or something? Let us say that we've been able to sort out the connectivity problems, right?
Correct.
We,
Correct.
what give me a sense of what could be possible inside yours or my home in terms of having somebody there, and how telemedicine, remote monitoring, and diagnostics. Give us a visual of what do you think happening in a couple of years from now. That's the future.
Well, let me take a shot at this.
Hmm.
So, okay, there are two scenarios, right? One is like a hyper realistic situation where we have connected devices that just plug in and scan us, give us details that we need. But then there is this quite doable reality that is it's not that far off. For example, let's go down the molecular route. One of the things that molecular testing actually brings us is, as opposed to say a blood test, which you have to take out a blood sample, and often a patient shouldn't do it himself. It Those molecules and those antibodies, enzymes actually also exist in our saliva, in our sweat, in our urine, and all the normal body secretions, and they can then be tested at home as the quality and the capability of those tests actually get better. We already know antibodies actually can be tested with a card test, and there is just spectrum of tests that can be conducted on a card test. And urine actually always has been a test that can just be a dipstick, right? So we just need capable devices to scan, monitor them, and they can be a part of your phone or kiosks at home or in your apartment, where everyone in the apartment can just go down, give their sample and have their results in minutes on the phone, and it just becomes as simple as that. And once you have the results and the data necessary for it, consultations become much more active, right? You can now consult with more context. So the doctor is more confident when he's consulting, as opposed to a raw consultation when it's very hard to, speak just purely on symptoms. If I complement that symptoms with diagnostic data, they now just become a lot of actionable data. And I think that's kind of where we are headed. Diagnostics is really driving that actionable insight for clinicians and patients. So for sure.
So, so what you're saying is work from home as a reality to getting treated at home is also going to be a reality. So
Correct.
you envisage that there is an apartment complex and there are some monitoring equipment there,
Correct.
some diagnostic equipment that are there. So the data from there is going to the doctors, who's going through it, ordering the medicines which get delivered to you online through an
Yeah.
online
Yeah.
agency, and then you are again being monitored through various gadgets,
Correct.
that are available to your thing, which seems to be a reality that is possible, right? And
Correct.
that too in the not too distant future.
True.
Now, where do you think are changes in terms of the new normal that are going to change? We are going to have a new normal which none of us know about. We all are, grappling with what the new normal would be. Now, there would be certain needs of the consumer, which could be in terms of testing, in terms of reporting, and how does that future uh, entail for these maybe standalone diagnostic labs, and what do they need to do to maybe scale up to be able to cater to that demand? Because frankly, a tier 3 customer may also expect the same what a tier 1 city customer expects, right?
Correct.
Because the price points may be same or even lesser in a tier 1 city. So
Correct.
what do you think needs to be done by some of these standalone diagnostic labs or standalone hospitals to be able to uh, scale up to that need of this consumer?
Well, I think the challenge of the new normal is very different for healthcare, right? Like especially the healthcare providers, because that new normal is heavily dependent on quality of care and the scale of that quality of care. We now expect every hospital to have, you know, um, resources, right from oxygen to enough beds, doctors, everything available. And it's hard. It's a very hard problem. Applying this to laboratories, we expect pretty much every corner lab to have capability of RT-PCR testing, or even whatsoever necessary type of testing. And I think there are two ways this changes. One is the scale and the quality of testing that labs can provide, and second is the type of patient experience and value to patients they can provide. On the scale and quality, well, largely it's a technology discussion, but otherwise also it's a problem that pretty much every lab ends up facing, because the minute, if they're doing 10 patients a day, it's fine. If they're doing 100, it's not scalable. One staff member is not available due to, say, he calls in sick, your lab is not functioning today, or your delayed samples, which ultimately has patient impact. And on the other end, patients now expect, if I do a test, I get certain directive insight. If I do a lipid profile, or if I do a thyroid test, I expect what high cholesterol really means for me, and what am I supposed to do for that. And the best way labs can actually capture this and add value to this is via providing insights on that report, and not make it a very traditional bookish lab report, but actually add value. Yeah. So to add more value, to add maybe longitudinal data to patients who can now know their progress, who can now understand why that test matters, and what is it to monitor that result. So basically, educating people about their own health will take us very far, because we now know that people prefer to do a COVID test before they travel, and this has been, if we really look at it, it's largely educational, right? Because everyone's talking about it, that you should do a COVID test. It's the same for other set of diagnostic tests. Routine checkups, say on an annual basis, can take this very far. People can know more about where their health body stands, and they can make informed decisions, because every body is different, and it reacts differently. So
sure. And I think the insurance companies will play a part in this too, as we go forward, in terms of early checks, and how we can balance testing and being a hypochondriac. Somewhere in the middle is where we intend to be. In what you're saying is, you said something about historical context. So
yes.
In terms of medical records, what you're saying is that labs should be able to give historical data to the clinician at every given moment of time.
Correct.
Okay. Now,
Correct.
how do I sync these medical records if I'm doing testing from various different labs? There are digitized medical record solutions. I'm sure they exist.
Yes.
But where do you think that the future is in terms of my medical records as a patient of the future?
Well, quite honestly, I really believe in what the NDHM team is actually out to do, where the records are like your UPI account, right? You just access and transact. You want to share a record, you can just access via a common health ID app and just transact via that. And the system itself takes care of interoperability, getting those records across multiple providers on one platform, and then transacting that. That being said, well, Sumit, we patients of ours actually don't have to worry about multiple providers, right? They get a single login, reports instantly, and they in fact get a trend of their health right there. But we agree that the system is much larger than a single company, and
Of course.
it has to be a partnered effort, right? It has to be an effort where all healthcare providers, hospitals are contributing their data towards one single endpoint. And I think I think at max 2 years we should be there.
Okay. Because I don't even today think so that PDF reports,
Yes.
are the solution, right? PDF reports are as good or as bad as having two sets of papers around.
Yes.
Whichever way that you look at it, if data can be somehow be able to be consolidated to the clinician, and the
Correct.
historical base that he would get out of that would make a lot of sense. So
True.
in conclusion, I can see a vision of yours of a patient who's doing testing in his apartment complex or in his house, having that sent to the clinician who has a historical
Correct.
data available to him, and who
Yeah.
can then change or continue medication, which then gets delivered through your choosing of uh, uh, a provider, which comes to you, and then your monitoring happens online again. So
Correct.
in a way, for some of these mild diseases, I'm sure the curative thing lies at home, which even
Correct.
now exists, but with better monitoring, better everything. And the
Yes.
hospitals move on to, taking up much more serious uh,
Correct.
cases and stuff like that. So at times, existing capacities can be used much more efficiently.
True
So
that.
okay. So
No,
great.
and, seconding to your point, actually, so we know that we can't really stress the system enough, right? Like it'll break, and it has,
Yes.
and we know that prevention is always been better than the cure part. But we don't have system. We've barely invested into prevention, right? And of course, there have been big diagnostic companies really rallying that effort. But I think prevention is much more than that, right? It's not just a diagnostic test, but it's actually an informed decision about when and how to do it. Not always just repeatedly doing something without a direction. That direction is probably the most important thing we should have. And the lesser burden we reduce, the more home healthcare services we have, the more capable, efficient our healthcare system would be, I feel. And yeah, and less
And
stressed.
of course, and that's how care improves, right? At the end of the day.
Correct.
That's how quality of care would improve at the end of the day. Good. So thank you, Abhimanyu, for your wonderful words on this futuristic Friday. It was fabulous to have you with us, and
Pleasure
may
talking.
what you do grow exponentially for patients tomorrow to be able to get, as reports with very few errors, or rather nothing in terms of errors. And I think so. Thanks to you and companies like you and the entire ecosystem, that we have been able to scale up testing.
Yeah.
I still think that the world sometimes doesn't realize what 1.2 billion or 1.3 billion people are about, and how a
Correct.
small percentage of that itself is
Is
huge. So well done, and good luck for the future, and take care. And I think so. We'll close the futuristic Friday talk with this. And thank you for being with us. Any last thoughts, Abhimanyu, before we close?
well, I would say, I think we are already in the future. It's just like day-to-day decisions and choices that we make that really shape that future for our children and the next generation. And yeah, I think it's great to speak with you as well, Sumit, and would look forward to staying in touch with you. Good to see you.
Pleasure is mine, Abhimanyu, and all the best. Have a great weekend, if there is one,
Yeah.
for you guys. Take care. Bye bye,
Okay.
and thank you
Bye.
everybody for watching.